Welcome and thanks for joining us. My guest today is John Boerstler, the Chief Veterans Experience Officer for the Department of Veterans Affairs. John, thanks again for joining us.
Absolutely. Thanks for having me.
To dive into the topic here, because I know VA has been laser focused on all things veterans experience for a while now and has really been a leader across government in this customer experience space. What do you see as VA's top CX accomplishments in recent years? And looking forward, what are the kinds of things you guys are still looking to do and exceed?
Yeah, no, thanks again for having me. There's a lot I think that we've been working on as you referred to, and a lot that we're proud of. And I always say, we've come a long way. We still have a really long way to go. But some of our more recent successes, I think, really center around the fact that we've really moved the needle in terms of how we not only measure and understand customer experience here at VA for our veterans and their families, but actually moving the needle literally with some of our customer experience scores. So when we started measuring customer experience in 2016, and I know that we've talked about this on this channel a few times with y'all at the Federal News Network. Um, when we started measuring customer experience in 2016, trust, ease, effectiveness, and emotion, we're at 55% trust with veterans and their families. Now we stand almost at 80% and at 79%, which is pretty incredible. The journey that we've been on over those intervening years, and really the best way to describe it, then the best way of the that we've actually gotten to that great score, and aspirationally wanting to be at 90%, of course, is really the employees that make up VA. So our 400,000 plus incredible humans that are working out in the hospitals and the clinics and the regional benefits offices and the cemeteries every day to improve the lives of our veterans, and training them and how to deliver a world-class customer experience has really been where the rubber meets the road. So, as y'all probably talk about a lot with other customer experience professionals, you can't have a world-class customer experience without a world-class employee experience. So literally arming our employees with better training and better tools and better data, so that they can properly engage those veterans and their families and deliver that world-class experience has been really impactful for us. We've had a couple of other big wins in terms of looking at how we are codified not only within the department, but now we have some legislation that wants to codify the Veterans Experience Office within statute, which is very exciting. And I think it's a necessary mechanism for us to really show how impactful and how important this office is to the overall success of VA, just as many other offices are across the federal government. But as we're looking forward, I think some of the most exciting opportunities for us are not only to codify the Veterans Experience Office and thereby permanently codify customer experience and employee experience at the Department of Veterans Affairs, but really thinking about how we readjust our customer acquisition funnel. Government really doesn't think about how we might acquire more customers and ensure that we're delivering a great experience. And so it's been really fun to think about that in the last 3+ years that I've been back in service, and what pain points, bright spots, and moments that matter along the individual veteran journey are most important that we can really focus on. And I'd love to talk more about some of those here today.
Yeah, great introduction to the topic here, and I think you really hit on the wide scope of what VA does for veterans. It is the healthcare side of things. It is the benefits side of things. It is the veterans cemeteries as well, and beyond that, there's just so much that the VA does for veterans. To look at one particular strand of things here, the Biden administration has really been looking at life experiences as a lens to improve customer experience. And I know that VA is really closely involved in one of those, and that is the experience of transitioning from active duty military to being a veteran, going back to civilian life and figuring out things there. What is VA doing to improve that experience? What have the pain points been as of late, and how are you guys looking to make that a more seamless transition for veterans?
Thinking about readjusting that customer acquisition funnel is a huge opportunity. And our first touch point with our soon-to-be veterans, those transitioning service members, those young men and women and their families that are leaving the military, that's our first opportunity to really wow them, to really delight them, to really ensure that they have a successful reintegration from military to civilian life. And in many ways, we're not designing for that persona or multiple personas, as we discovered after interviewing hundreds of transitioning service members, recently separated veterans, and their family members. We were able to develop four of those types of persona types that you can see on the performance.gov website that we've been able to publish with our partners at the Department of Defense, Department of Labor, Office of Management and Budget, et cetera. And I think making sure that we're better understanding what their pain points are along that journey, namely that, you know, we have to think about it from a generational lens. Like most of the active military force, all 6 service branches and the Enterprise Defense Department, I mean, they're millennials and Gen Z, right? That are raising their right hand and swearing in to protect and defend the Constitution of the United States. And a lot of our course materials and our curriculum, just what we found was didn't really resonate with those generations. And so how might we make a more immersive experience in the transition assistance program 1-day course? And how might we present this information about the benefits and the healthcare that they're eligible for much further upstream? Almost every individual we spoke with who was either in the process of separating from the military or had recently separated from the military, they said, I wish I had known about this benefit or this program earlier. I wish that I could have engaged. I wish that my spouse could have attended the course with me. I wish that I had started the transition assistance program pathway at the right time, because it's required to start it at least 1 year before separation for those individuals leaving the military after a few terms, and 24 months, 2 years for those that are retiring. So we're working in the interagency space, like I mentioned, all 6 service branches, Enterprise Defense Department, Department of Labor, Office of Management and Budget, Department of Education, Small Business Administration, you name it, everyone that has a stake in that process on the federal government side. And of course, VA, where the most vested interest is, in my view, to really rethink and redesign this experience for not only the different types of personas that we're now aware of, but really thinking about it, personalizing it. So right now we're developing a minimum viable product that will solve for a lot of the pain points that I mentioned earlier. It'll allow them to enroll into a digital experience right after they finish their training school at the beginning of their service, so that they're able to then understand exactly what they need and when they need to pursue it based on their expiration of term of service date or their EAS date. You know, we call it different things in different service branches. And then we'll send them pushes along that journey when they're eligible. So automatically when they enlist or they commission, they're eligible for VA home loans. They're eligible to call the Veteran Crisis Line if they need to. They're eligible to go to one of our 300 vet centers for family counseling or mental health counseling, or to be a part of a peer support group. And then as they get closer to that 12 months prior to separation, and then even that 6 months prior to separation, they're allowed to file a disability claim. They're allowed to start exploring their GI Bill education benefits. They're allowed to do so many other things, but just making them more aware and personalizing it based on exactly what their priorities are when they are planning to leave the military, whether that's going to school, whether that's getting a new job, whether that's relocating their family. There's so much that we could be doing to really improve this customer experience. And it's been a real pleasure to work with our interagency partners and actually kind of in many ways, it's been so great to see the 6 service branches that run the transition assistance program on the DoD side, the Defense Department side, really get excited about human-centered design and the methodology that we use, the ethnographic research, the in-depth interviews, the focus groups, the journey mapping, the service blueprinting, and the persona work that we've done with them. So hopefully we'll have a product to test this summer, and then fingers crossed, launch later this year in the fall. So just excited to talk a little bit more about that and how I think we're rethinking the customer acquisition process at VA and how big of an opportunity is for us to make sure that these individuals transition successfully.
That's exciting to hear. It seems like the real name of the game with that minimal viable product that you guys are looking at is really to have visibility in the service members' experience in the military long before they even are themselves a veteran. Is that the general principle of what we're talking about?
It is that is the gist of it, and personalizing those services into a checklist, a digital checklist that they can take with them. Once again, designing for Gen Z and millennials, they want it in the palm of their hands. They want it mobile friendly. They want it. They want push notifications. They want to enroll. They want to test things out. And so we are going to build an ecosystem where they can do all of those things and enroll in the benefits and care that they so rightly have earned.
Yeah. John, going back to your comments earlier about readjusting that customer acquisition funnel, I imagine that is front of mind for a lot of folks over at VA. Particularly as they're rolling out the PACT Act, getting toxic exposure, veterans exposed to toxic exposure, and hazardous substances during their military service, and more broadly, just veterans who are untethered from VA services, don't have that relationship yet with VA and the services that they offer. Looking at both of those things here, what is VA looking to do to reach out to those underserved veterans who are not enrolled in VA healthcare or benefits?
We're doing a lot, um, more than VA's ever done. And in the last year, we've seen the results. We're now delivering more care and more benefits to more veterans than ever before in our history. And in many cases, it's because of the authorities that the PACT Act has given us, to reach out to millions of toxic exposed veterans to inform them of the benefits and care that they're now eligible for based on the passage of that law. And it's also letting a lot of other veterans who may not be eligible for PACT Act or that may not have been exposed to different toxins while in service, either at home or abroad. But just getting the word out about general VA benefits and care that they're probably also eligible for. So home loan guarantee, as I mentioned, programming, GI Bill benefits, disability compensation benefits, VA life insurance benefits, VA healthcare, which is world class when we benchmark against other healthcare systems. Be happy to talk a little bit more about that too, and the patient experience here at VA. So I think it's been a unique opportunity for us to use every channel available. So we're not only communicating via postmail, which is the tried and true method of government and pretty much any company, right? But when somebody sends you a letter from the government or a postcard, people tend to open it up, which is great. But how do we open up other channels of communication, namely email and now text message? So we're now sending, hundreds of thousands of emails every week to let veterans of different cohorts know that they're eligible with specific tailored content that would resonate most with them. For example, last week we sent out an email to a couple 100,000 Vietnam veterans who are now eligible to enroll in VA healthcare based on PACT Act authorities in different sections of the law. And we had 1,800 new Vietnam veterans who had never engaged in VA care before enroll in healthcare, which is incredible, especially at the age that most Vietnam veterans are in their lives. I think it's an incredible benefit and an incredible opportunity for them to engage in the best healthcare system in the country. We're sending about 300,000 emails out to Afghanistan veterans next week. And then 2 weeks after that, Iraq veterans with specific tailored content that would resonate with those personas so that they are now more aware of those benefits. And as I mentioned, we're also text messaging. So for the first time, we're using outbound text messaging and as a tool to really say, hey, did you know that you might be eligible for VA benefits and care? Call us at 1-800-MY-VA411, our telephonic front door, or visit us online at va.gov/PACT and our digital front door. And we'd love to start a lifelong relationship with you. And they can always opt out of both email and text message, of course. But I think it's just an incredible opportunity to communicate with veterans in new and innovative ways. We're also building AI chatbots, so that folks, when they come online, they can any hour of the day, or night, they can communicate. They can get their questions answered. They can call us at 1-800-MY-VA 411 24 hours a day, 7 days a week, and get connected to those benefits and care that they may need, or ask questions. So there's really a multi-channel environment that we've set up, and I think that's really only the beginning now as we explore other digital and mobile avenues to communicate with these folks.
To zero in on this idea of personas that you've been talking about, let's drill into that a little bit more. How is VA crafting those personas? Understanding generationally, what is the most effective way to communicate with these veterans? Understanding that that those preferences change and evolve over time. Going from the snail mail to the email to the text messaging. How do you find the most effective way to meet veterans where they are?
Yeah, I think that's a great question, and it's a question that any organization, company, or government agency it asks itself during when they're launching a product, or they're extending a service offering to their audiences. And I think as we design for different populations, we've essentially better understood about 80 different journeys so far with the Veterans Experience Office in the last 9 years that we've been in existence. And it can go from a big cohort like Vietnam veterans and understanding that as a persona, to women veterans who served in the Gulf War. It can get zero into LGBTQ plus veterans and the pain points that they experience while accessing VA benefits and care, Native American veterans, veterans that live in the Pacific Islands, and in Hawaii and Guam. And so we've literally designed, I think at this point, for almost every persona that we could think of, to ensure that we're addressing not only identifying those pain points, but addressing them in our process. And we've seen massive upticks in trust from those populations, be that women veterans, who are our fastest growing cohort of customers, or minority veterans, or LGBTQ plus veterans, noting that we still have a long way to go for a lot of these underserved populations, and getting them to trust VA and come to VA for the earned benefits and care. But year over year, we've seen an incredible increase in not only enrollment in healthcare. We've seen a 30% enrollment year over year in VA healthcare. And this is with a declining overall veteran population, by the way. We've seen a 30% uptick. We've seen a more than 30% uptick in the number of claims, disability claims filed, mainly because of PACT Act, but just because of the general awareness that we're putting out into the world to build trust, not only with veterans and their families, but the general public, that VA is world class and we are here to help you.
And John, picking up on this whole idea of meeting veterans where they are, I'd be remiss if I didn't bring up the VA mobile app. I think since it's launched, it's been very successful doing just that. Can you tell me a little bit more about how that mobile app is really key to VA's digital experience strategy, and what the future of that app might look like going forward?
Yeah, I got it right here on my phone, because I'm not only the chief experience officer here at VA, but I'm also a customer, and I use VA for all of my healthcare. I've, uh, benefited from many of the different programs like the GI Bill and VA disability compensation, and others. And what I love about the mobile app, and what I think Charles Worthington, our CTO, and his incredible team have done, not only building it, but thinking about using human-centered design, thinking about putting the veteran at the center of that design process. It was not only designed for kind of any generation of veteran, but especially like low visibility or blinded veterans. So as you kind of work through the app, you can see how clear the buttons are, and how large the print is. When you go and you click into the healthcare section, you can review all of your upcoming appointments, all of your past appointments, in case you need to remind your doctor or nurse of different occasions you've had engaged in specialty care or primary care. You can message your provider team, your care team, which is an incredible asset. Usually before this, you would have to go online and log in, two-factor authentication onto va.gov, and then direct message your care team. Now you can do it from the palm of your hands by accessing it through biometrics, so either your face or your thumbprint or your fingerprint, which is incredible, and to be able to do that 3 clicks away from everything. You can fill your pharmacy prescriptions and then they show up at your door, which is talk about customer experience. It's truly in the Amazon age that we all are in, right, where things just arrive. It's pretty incredible that you don't have to walk down to your neighborhood pharmacy or drive an exorbitant amount of way. If you're in a rural area in particular, it shows up at your doorstep, which is pretty awesome. You can check on the status of claims. You can view your letters of service. You can see exactly what records you have available to show, and then you can prove your identity that you are a veteran. If you're going to Home Depot or Bed Bath and Beyond and trying to get that veteran discount, you can say, hey, here I am. I'm a Marine Corps veteran and I served from these years honorably. So happy. I'm a very happy VA customer, and I get to use it kind of almost like as secret shopping, and so I get to in my own pursuit of world-class healthcare, I get to learn about some of the pain points and the bright spots. And I got to say, most of them are bright spots. And I take every single survey that the Veterans Experience Office sends me. You better believe I participate in it, because we do listen to that feedback. So take your surveys if we have any veterans or family members out there listening to this podcast.
Pivoting back to the idea of empowering VA employees to drive this customer experience improvement. In terms of, you were saying the training, that's had to evolve. Making sure that they have the data at their fingertips to better serve veterans. How have you seen that improve in recent years, and how you hoping that continues to evolve in the upcoming years?
Yeah, I think it is the method by which we've achieved so much success, is by getting out there and showing, a medical center leadership team the data on what are some of the pain points around how veterans are parking at their facility or navigating their facility, what the pain points are in the routine of care. Do they understand what their providers are telling them? On the benefit side, do they understand, what their benefit, what their veteran service representative or their loan guarantee officer is telling them about the benefits they're trying to access? And we're also looking at metrics that show, do they feel respected in these encounters? And do they trust VA to deliver the benefits and care that they have so rightly earned, as I mentioned earlier? And not only diving deep into the data, but drawing lessons of exactly what types of training we would prescribe to not only deliver directly to their employees, but we use the train the trainer model, because that's how you achieve true scale. Is like, we pick those champions of each service line in a hospital, for example, and train them to then deliver that training to all new VA employees when they're onboarded at that hospital and in their clinics and their system. And then we make sure that they're certified every year to continue that training. So we have our Own the Moment training, which is kind of our signature training here at VA. We have our We Care leadership rounding. So if you're a leader at any level, it's encouraging you to go and speak to your employees and speak to veterans. Do that not only during business hours, but in off hours, because we know that folks work 24/7 shifts, especially in the healthcare system. We launched a new training about a year and a half ago called Tour of Duty, which is kind of an enhanced, not only military cultural competence training, and trying to teach our new employees about what what military service is and why their mission is so important. But more importantly, why their service and VA is so important. So we actually have the secretary swear each employee in at the end of the tour of duty, because they too are serving our country in this incredible way to take care of our veterans and families. So I think we've seen that 55% move all the way up to 79%, knowing aspirationally we got to get to 90%, because veterans and their families deserve nothing less than an A. But that is where the rubber meets the road, is actually getting out there, looking at the data, and then training those employees and arming them with that information, those tools to deliver that world-class experience that veterans deserve.
Yeah. Yeah, and I think it's important to underscore, John, that for a lot of VA employees, they are much like yourself, veterans, and so this is a second tour of duty of them serving their country.
Indeed.
Yeah, I just always think of that as important to bring up. One other way to look at this, VA is, of course, not just doing this good work internally, but they are, an intergovernmental leader on CX. They are one of a few agencies leading on this in the president's management agenda, and really kind of just setting that standard for agencies who may be newer to this whole idea of customer experience. Uh, that in mind, for those agencies that are maybe a little bit uh, earlier on in the learning curve when it comes to CX improvements, what can they learn from VA? What would you offer up as kind of the lessons learned, or just the things that are most foundational to getting started on this?
Yeah, that's a great question. Well, I'd always recommend starting with our CX or cookbook, our customer experience cookbook that we put together a few years ago that can really, in more general terms, this is the VA journey at how we view customer experience and how we move the needle so far in the 9 years that we've been around here at the Veterans Experience Office. But what I would offer as advice, and I communicate with a lot of our federal partners, and actually Dana from the Department of Homeland Security was here a couple of weeks ago, and we picked up some really great ideas from what Department of Homeland Security is doing, not only in TSA, Transportation Security Administration that everybody experiences if you fly, to U.S. Citizenship and Immigration Services and what they're doing at FEMA on the disaster assistance side. It's really, really incredible to learn from their experience and draw from that. But what I would offer as a recommendation is, we almost started in the middle of our journey map. So if you look at the veteran journey map that was published in 2015, it really starts out as when a veteran's already accessing VA care. Well, there's a whole lot of moments that matter before that leads them to enrolling in VA healthcare and accessing their VA healthcare. And the reason we did this is that we were really responding to a crisis, an access crisis that happened in 2014 with starting in the Phoenix VA Medical Center, following an OIG report that found that veterans, weren't able to access their mental health care appointments and other healthcare appointments, and that really led to not only the creation of the Veterans Experience Office, but this focus on human-centered design and thinking about how we deliver benefits and care from the customer, the veteran's perspective, not from the organizational or the VA perspective, right? So when thinking about that, we're now kind of not shifting our focus from off of our healthcare, because that's full steam ahead. Those are the most numerically some of the most touch points we have with our customers every single day, millions with through VA healthcare. But we're also thinking about, well, how might we better design the onboarding process, that customer acquisition funnel, so to speak, as we talked about earlier, that really starts with the transition from military to civilian life, our first opportunity. And then when they're filing their disability claim or enrolling in VA education benefits for their GI Bill education benefits, those are some of the first two programs that in most cases veterans will access after leaving the military. And so how do we think about those programs, those three opportunities, to really wow them and then get them connected to VA healthcare much earlier in that journey, all the while making sure that they have a wonderful customer experience and that we're listening to them and providing and learning from that feedback in a consistent way. So it's really neat to be able to think about, once again, those, not only those three programs, but how we shift to the further to the left of that journey, and then serve the veteran throughout their entire lifetime, knowing that their families are still going to have a phenomenal experience when they're laid to rest at one of our incredible national cemeteries. So lots of work being done on all parts of the journey, but really important to think about the acquisition and that new to VA experience, so to speak.
Yeah. And of course, VA is always keeping an open mind when it comes to new tools, new technologies, new processes, new ways of improving that customer experience. I know a recent thing that a lot of agencies have been looking at is artificial intelligence, just one tool in the toolbox here. But John, can you tell me a little bit more about what new things VA is considering adding to its repertoire when it comes to improving that level of experience and improving that customer experience?
Absolutely. We're looking at a bunch of different tools, I think, that can improve not only the customer experience, but the employee experience too. If you think about ambient dictation being used in clinical settings for primary or specialty care appointments, where instead of the doctor or the nurse talking to you and sitting at their computer typing the notes and then having to look over and talk to you and then type more notes, you have this tool that's able to capture the conversation and then categorize parcels of the conversation into the medical record. Other healthcare systems are already using this. VA, the Undersecretary for Health, Dr. Elnahal, is very much looking into how might we use these types of tools to not only streamline the customer experience so that you have that conversation, with the doctor without having to make notes in a more consistent way, but also it helps to improve the employee experience for the doctor and their care team that's supporting them. So, and then as soon as they verify that if they talk about prescriptions or they talk about different specialty care referrals, all that is then categorized in the medical record, and they review it to make sure it is correct, and then action is taken. So we're able to save. I think, I was talking to another healthcare system about how they've implemented this technology recently, and they say that a physician or a special or a nurse or anyone in that care team can save on average an hour and a half to 3 hours of clinical time every day. And I'm like, that's incredible, right? How many more patients might you be able to see, or how many other activities can you get done if you're not having to dictate in a manual way? So there's also a lot of other cool things that we're thinking about, once again, to improve the customer experience, but also to arm our employees with more information. There's a lot of information out there about VA benefits and care, and not every single employee at VA understands everything, not even me, right? As a user and as the Chief Veterans Experience Officer. And so how might we use large language models that access the entire VA.gov enclave, put different responses, narrative responses based on a customer's question. For a social worker, for example, they're meeting with a veteran and they have a specific question about something the social worker isn't necessarily an expert on, then they can ask that question to a Gen AI tool that we can develop, and then it comes with a narrative response. And the social worker, being an expert, having that human look, can then say, well, this sounds right to me, and they can relay that information to the patient. Or this doesn't sound right to me. This actually doesn't sound safe. So let's not share that information. And then they can actually, as the social worker, can go in and let us know whether that information was useful or not, and whether it seemed correct. And then we can annotate and then continue to train the model to improve. So these are all things that we haven't put into action yet. We're considering, we're doing discovery with other healthcare systems, with other benefits delivery systems, to see how they're being utilized in other different journeys. And then we've built an AI governance council that will consider all of these new projects, like many other agencies have, based on the artificial intelligence executive order that came out earlier this year. How do we consider these in a responsible way, knowing that we can't risk any harm to come to customers or employees, and ensuring that we're testing it appropriately before going to market.
All right. Well, to bring this conversation full circle, we started out by talking about veteran trust, how that is the metric that matters, really above all else when it comes to everything CX involved. We have heard from a number of Biden administration officials who are leading on these government-wide CX efforts that, any customer experience out there, any service out there, when you're applying, that is such a make or break moment for trust, that if it goes well, you have more trust in that institution. And if it doesn't go well, your trust in that institution diminishes. And, it seems like this is something that VA has really internalized quite intensely over the past couple of years, with the Veterans Experience Office, driving all of this. I just wondered if you could elaborate a little bit more on, those moments that matter, how VA, ensures that those uh, abilities to sign up for programs, that they are high reliability, and that if in those, moments where things don't go as anticipated, you guys do what you can to, build back that trust in veterans who may have, had a less than stellar experience that first time around.
Yeah, absolutely. So as a patient, when you go in and you visit your primary care or your specialty care provider, and usually if you're put into the sample pool for our V signal survey or veteran signal survey, you'll get that, 3 days after your appointment. So pretty fresh. It's not months later like some other standardized surveys are, especially in healthcare. And you'll be able to deliver, your experience, and you can, at the end of the 1 to 5 Likert scale questions, there's an opportunity to leave qualitative free text feedback. And based on the free text feedback, we kind of categorize them into 3 different buckets, so to speak. We have compliments, which is 70% of all free text comments are compliments of the care or the experience that they've had with the VA employee or the process itself. The other 30% are made up of a combination of concerns or recommendations. Any concern or recommendation that is filed in those surveys, and these are millions of surveys taken every month, go automatically into a queue, an electronic queue that our patient advocates and our veteran experience officers at each facility on the healthcare side will then follow up and conduct service recovery on in each individual case. And that's where we're not only able to provide that veteran more information or ensure that they have a better experience the next appointment they have, but also to learn from their experience and then adjust that process or ensure that the service chief is aware of an incident that may have occurred, or shifting the way that care is delivered, or even the culture of a team. And so I think that feedback loop, the quantitative side and the mixture of the qualitative side, that will provide that leadership team at each of our individual medical systems, or the regional benefits offices or the cemeteries, with that real-time data to say, okay, here are our operational metrics, like number of appointments, number of claims filed, number of burials conducted. And then as a co-equal measure, we have our customer or our patient experience or our benefits experience metrics to balance it out and to show the full site picture of what's happening in their area of operations. So that's really how we conduct the service recovery using the vSignals platform as a feedback mechanism. Of course, there are other channels that veterans can share their feedback with us, but we think that this one has been the most effective. And once again, one of the arrows in the quiver, so to speak, of the Veteran Experience Office and each individual facility leader, so that they can improve that journey and improve that experience for each individual veteran who goes through our system.
Well, John, thanks again for taking the time to speak with me here. In closing, is there anything that we left out that you want to make sure we get across, or is there anything you want to underscore for our audience before we close things out?
The only other thing I would say is we've seen a lot of scam and fraud attempts and predatory actors, going after veterans and their benefits and their health care. And we are not only doing a better job at understanding the types of tactics being used by those predatory actors, but we've also started the Veteran Scam and Fraud Evasion Task Force with our other federal agencies, so that veterans will now be able to not only identify the scam and fraud attempts, but also learn how to report it to the federal agency that has enforcement authority in that individual vertical. So they can go to va.gov/vsafe, VSAFE, and be able to learn more about that effort. But just be on the lookout, be vigilant around the scams and the fraud coming toward veterans and their families.
I'd like to thank today's guest, John Boerstler, the Chief Veterans Experience Officer for the Department of Veterans Affairs. I'm your moderator, Jory Heckman, and you're watching Federal News Network. Now let me send you back to the studio for more on the CX Exchange.